Assalamualaikum everyone. Today we are going to talk about respiratory system. Our main point presentation are the way physiological adaptation of during respiratory system vary during exercise and physical activity, particularly in athletic experience condition such as exercise-induced asthma, respiratory muscle fatigue, altitude training adaptation, and strategies that can be discussed to optimize respiratory function for improved performance in such scenarios. First, let's look at exercise-induced asthma, or we call it as EIA. So, it basically occurs when do a physical activity that leads to the narrowing of the airways. It also the asthma symptoms such as wheezing, coughing, and also shortness of breath. This condition typically arise during or after exercise, as increased breathing rate can cause the airway to become inflamed, and it also making it difficult to breathe. Then we move to how to managing EIA. The first one, we can use a pre-exercise inhalers. This will help to open the airways before exercise. Next, the second one is we can do a warm-up, which means slow gradual warm-up can prevent sudden airway narrowing. Next, we also can use a lot of method of breathing techniques. It is to focus on control breathing to keep airways open, and the last way is to avoid triggers. If possible, avoid exercising in cold, dry, or polluted air. First of all, what is muscle fatigue? Muscle fatigue is known as temporary condition that decrease the capacity of cardiovascular muscle to do respiratory system and make respiratory system cannot perform well. This happens when energy demand more than energy supply. Next, we go to the causes of respiratory muscle fatigue. First is exceeded of lactic acid production in the body. What is lactic acid? Lactic acid, known as an anaerobic respiration that occur in the body without oxygen to produce 2 ATP molecules, energy, and lactic acid molecule. Other than that, total amount of ATP produced from stored glycogen in body is lower than the complete anaerobic breakdown. Then glycogen store rapidly finish when large amount of lactic acid produced. Secondly, impair of nervous system function can lead to respiratory muscle fatigue. This happens because central fatigue originates at the CNS and decrease the neural impulse that drive to the muscle. This caused by an inhibitor produced by nervous impulse from the receptor in the fatigue muscle. Thus, inhibitor act on the muscle pathway from the voluntary center in brain to the spinal motor neurons. Thirdly, causes of respiratory muscle fatigue is electrolyte imbalance in the body. This happens when body was exceeded accumulation of ammonia and hydrogen ions after doing high intensity activity, and it can slow down muscle contraction and the muscle tension development. The example of electrolyte is the body needs sodium, potassium, calcium, and magnesium. Next is symptom of respiratory muscle fatigue. First is use accessory of muscle. Neck, abdominal, or chest muscles are used to assist in breathing. It will reduce breathing efficiency and will increase work of breathing. Second is cyanosis. Cyanosis is typically can be seen on mucous membrane like lips or fingertips. It is a bluish tint to the skin, and it also indicating lack of oxygen. Third one is rapid shallow breathing. It will increase rate of breathing but less of efficiency. This happens because the body is struggling to reach its oxygen demands and trying to let out carbon dioxide. Then we go to the how to manage respiratory muscle fatigue. First is oxygen therapy. Oxygen therapy can reduce respiratory muscle overwork and improve oxygenation. Oxygen therapy is a medical treatment to maintain the oxygen levels in the blood. Second is nutritional support. Nutritional support can ensure sufficient intake of nutrients that is useful for muscle recovery and functions. Last but not least is respiratory muscle training, or we call as RMT. RMT is an exercise that designed to strengthen respiratory muscles and improve endurance.
Hi and Assalamualaikum. I am Muhammad Bakri bin Ahmad Kamal, and the first thing I want to talk is about the altitude training. So what is the altitude training? It's a training performed at high altitude above 2000 meters above the sea level, where the air contains less oxygen compared to the sea level. This condition called as hypoxia. So how does these people adapt to the high level or the high altitude? There are many ways these people adapt to the high altitude. The first one is the increase of ventilation, or what we call the hyperventilation, and the second one is the increased oxygen extraction, and the third one is increased work of respiratory muscle. When exercising in physical activity at a high altitude during altitude training, the respiratory system undergoes specific physiological adaptation to cope with reduced oxygen availability. This is because the higher level of the mountain or whatever, the higher altitude place, is the oxygen level is lower than the sea level, so that the body will adapt to that low oxygen level. So this is the correct adaptation, that is when we do the altitude training over a days to weeks. The first one is increased alveolar capillary diffusion capacity. With the lungs pressure, the lungs may develop more efficient gas exchange mechanism. That is, with the long time period we do that long altitude training, we will develop our gas exchange mechanism. We can breathe easier. It allows a better oxygen uptake into the bloodstream. Yes. Second one is improve pulmonary ventilation efficiency. This breathing stabilize at a higher rate compared to the sea level. The respiratory muscle become more efficient as it reduces the energy cost of breathing. So when we do the higher level activity, the oxygen is low, and the respiratory muscle become more efficient at the high level. The third one is increase alveolar capillary diffusion capacity. Some athletes experience change in the lung volume to accommodate the increase of ventilation demands. So let's talk about the effect of the systematic adaptation of the respiratory system. The first one is the increased ventilation efficiency. It increased red blood cell count and oxygen carry capacity, reduced for the need of excessive ventilation to maintain oxygen levels, and the respiratory muscle experience reduced fatigue, and as breathing demands stabilizes, the breathing pattern become more efficient. The second one is the improved alveolar gas exchange. The exchange capillarization in the lungs. The blood flow is better to alveolar ventilation, optimizing oxygen intake and carbon dioxide elimination. And the gas exchange efficiency increase even at lower gas pressure. The third one is the altered chemoreceptor sensitivity. The brainstem and the peripheral chemoreceptor adapt to the hypoxia and altered blood chemistry. Peripheral chemoreceptor become more sensitive to low oxygen, sustaining an elevated but controlled ventilator response. The fourth one is the effect is the strengthened respiratory muscle. It increased ventilationary during the hypoxia challenge, the diaphragm and intercostals. The muscle has adapted stronger and less fatigue, allowing for sustained ventilation during high intensity activity. And the last one is the increased pulmonary capillary pressure and diffusion. Hypoxia induced vascular exchange, improved pulmonary capillary requirement. Oxygen diffusion from alveoli into the bloodstream become more effective, ensuring maximum oxygen extraction despite at low atmospheric oxygen. So the next point is the strategies to optimize the respiratory function. The first one is the breathing techniques. One of the breathing techniques we can use is the diaphragmatic breathing. This is one of the best techniques. Is also known as the belly breathing. This breathing technique also involves the diaphragm. The benefit of the diaphragmatic breathing is the help managing chronic stress, because it's promoting relaxation, because it help our body to relax, help encourage full oxygen exchange, strengthen the diaphragm, that is make our diaphragm stronger. Decrease breathing workload by slowing the breathing rate. So it's slow our breathing rate and decrease our breathing workload. And the direction on how to do the diaphragmatic breathing is The first one is lie down with one hand on chest and other hand on belly. That's like this. Slowly inhale and send breath down to belly, and slowly inhale, send breath down to belly, and exhale slowly through the mouth. Exhale slowly through the mouth. Repeat it a few times up to 5 minutes. So do this for 5 minutes, right? So for the second breathing techniques, we call it the box breathing. Box breathing is one of the simple exercise. The word box refers to the square shape of 4 parts in our breath cycle. The benefits of the box breathing is to regulate breath into its normal rhythm, clear our mind, and improve sense of peace on stress situation. It can reduce our stress, and the direction for the box breathing is, the first one is inhale for the count of 4. So inhale for the count of 4 seconds. The second one is hold breath for a count for 4 seconds. Inhale and hold for 4 seconds. Exhale for the count of 4. Exhale for the count of 4, and hold your count at 4. Repeat it until you feel calm. So when you stress, you can do this breathing technique so to lower your stress level. So for the second strategy to optimize respiratory system function is warm up and cool down. Warming up and cooling down can be beneficial for athletes to optimize and improve the performance of their respiratory function. The benefit of the warm up and cool down is warm up, we can increase our lung capacity, improve oxygen delivery, and enhance breathing control. And it also enhance our activity efficiency. The cool down is gradual decrease in heart rate and breathing rate. It enhance our oxygen utilization and reduce risk of post-exercise respiratory discomfort. So this is when we cool down our body being relaxed from the exercise. The exercise is stress our body, can stress our muscle, and when we cool down, the muscle is less stressed before the cool down activity. So for the last strategies to optimize respiratory function is the proper hydration. Hydration is the critical aspect of optimizing respiratory function, particularly for athletes, as it directly influences lung health, performance, and recovery. And below is several ways to which hydration impacts respiratory function and overall athletic performance. The first one is the maintain airway hydration. The respiratory tract is lined with mucus that helps trap and remove dust, pollutants, and dehydrated. Mucus can be thick and sticky, which can obstruct airflow and make the breathing more difficult. The second one is the regulate body temperature. When athletes exercise, their body temperature rises, and hydration play a key role in the temperature regulation. Adequate fluid intakes allow for efficient sweating and thermoregulation, preventing overheating. And the third one is the enhanced oxygen transport and utilization. Hydration helps maintain an optimal blood plasma volume, which is important for efficient blood oxygen transport. When dehydrated, blood volume can decrease, leading to reduced oxygen delivery to muscles tissues. This is all from us. Thank you for watching our video, and I hope you all like the video, you all like the content. And if you have anything to question about, you can contact us.